This video is dedicated to the memory of Andre
Uwaji,
whose legacy continues to inspire and remind us of the importance of mental health care and support. Welcome to today's video on suicide risk assessment and how to manage thoughts of suicide and self-harm. This is a sensitive but critical topic in mental health care. Suicide is a major public health issue, and as healthcare providers, it is essential that we are prepared to assess and manage individuals at risk. Whether you're a general practitioner, a therapist, or a community health worker, understanding how to effectively manage suicidal ideation and self-harming behaviors can be life-saving. Let's begin by understanding what suicide risk looks like. Suicide risk is not always easy to recognize. It's crucial that we remain vigilant, as many people who are suicidal may not outwardly express their intent. Suicide risk factors include previous suicide attempts. This is one of the strongest predictors of future attempts. Mental health conditions. Disorders like depression, bipolar disorder, schizophrenia, and anxiety significantly increase the risk of suicide. Substance abuse. Alcohol and drug use impair judgment and lower inhibitions, which can heighten suicidal behavior. Social isolation. A lack of social support or feelings of disconnection from others can increase the likelihood of suicide. Chronic pain or medical illness. Living with debilitating health conditions can increase feelings of hopelessness. It's important to note that suicide ideation can range from passing thoughts to intense immediate plans, and self-harm might or might not be part of this. It's critical that healthcare providers assess these symptoms carefully and non-judgmentally. Step 1. Assessing suicide risk. The first step in managing suicide risk is to assess the level of risk. Directly asking patients about their thoughts of suicide is often the most effective way to gauge the severity of the risk. You can ask, have you been thinking about hurting yourself or ending your life? Do you have a plan for how you would do it? Have you ever tried to hurt yourself in the past? While this might feel uncomfortable, asking about suicide directly does not put the idea in the person's head. Instead, it opens the door for an honest conversation and allows the healthcare provider to assess the situation with clarity. Active listening and creating a safe space for the patient to talk about their emotions are crucial. Risk assessment scales like the Columbia Suicide Severity Rating Scale, CSSRS, or PHQ-9 can also be helpful tools for identifying the severity of suicidal thoughts and guiding clinical decision-making. Step 2. Immediate safety. If the patient expresses immediate suicidal intent or a clear plan with access to means, such as weapons, medications, or other lethal methods, the highest priority is ensuring their safety. Immediate intervention may include removing harmful means. This includes securing medications, knives, or firearms. Referral to emergency care. If the patient's risk is high, hospitalization for 24/7 monitoring or urgent care may be required to prevent immediate harm. Involvement of a crisis intervention team. In some settings, this could mean involving trained mental health professionals or a suicide prevention hotline. Case scenario. Referral to higher level of care. Consider a case with John, a 35-year-old man experiencing severe depression and active suicidal ideation. John shares that he has a detailed plan to end his life and has access to medications that could be used for an overdose. After assessing the risk using the CSSRS and determining the imminent danger, you recognize that this situation requires immediate intervention. Since you are not equipped to provide 24/7 monitoring in your setting, you refer John to an inpatient psychiatric unit where he can receive intensive care and supervision until his risk is stabilized. In cases like these, referring patients to a higher level of care is crucial to ensure their immediate safety and prevent harm. Step 3. Ongoing management and treatment. For patients who are not in immediate danger but still at risk, ongoing management becomes crucial. This may include a combination of interventions, such as psychotherapy, therapies like cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, are effective in treating suicidal ideation by helping individuals manage negative thought patterns and emotion regulation. Pharmacological treatment. Antidepressants, mood stabilizers, or antipsychotic medications can be used to treat underlying mental health disorders that contribute to suicidal thoughts. However, it's essential to monitor patients closely when prescribing medication, as some medications can initially increase suicide risk in the early stages of treatment, especially in adolescence. Support systems, engaging family members, friends, or support networks can be beneficial. Building a strong support network ensures that the individual has someone to talk to and can check in when they're feeling overwhelmed. Follow-up appointments should be scheduled regularly to monitor progress, reassess the patient's emotional state, and make adjustments to the treatment plan as necessary. Reflection questions. Why is it important to directly ask patients about their thoughts on suicide rather than avoiding the topic? What steps can you take to ensure a patient's immediate safety if they are at high risk for self-harm? Step 4. Crisis plan and safety plans. A safety plan is an essential tool for anyone at risk of suicide. It's a written guide that includes emergency contacts, such as family members, friends, or mental health professionals. Coping strategies for moments of crisis, like deep breathing or distractions. Warning signs that the person can recognize when their thoughts are escalating, so they can take immediate action, like calling a support person or therapist. Commitment to stay safe. The person agrees to reach out for help if they begin experiencing suicidal thoughts again. By developing this safety plan, individuals have a practical tool to manage their emotions and reduce the risk of harm. Step 5. Post-crisis. Follow-up. After a depressive crisis, it's essential to ensure ongoing care through follow-up appointments. The provider should continue to assess the patient's mental state, check for emotional triggers, and continue psychotherapy and medication management. Reflection questions. How can creating a safety plan empower patients at risk for suicide to take control over their own safety? Why is it important to regularly reassess a patient's mental state and progress after a depressive crisis? In summary, managing suicide risk involves direct assessment, immediate safety measures, ongoing treatment, and the creation of a safety plan. By recognizing the signs early and taking proactive steps, healthcare providers can offer the support needed to help individuals manage their suicidal thoughts and reduce the risk of harm. Follow-up care is essential to ensuring that the patient continues on the path to recovery with appropriate monitoring and support. In the next video, we'll discuss management plans for high suicide risk patients and how to take steps to ensure their safety and well-being. Let's keep it going, and I'll see you in the next one.